Programme. Thank you, Simon, for being the DJ there, fading us out. Hope you're enjoying that music. It's nice to listen to something uplifting, isn't it, on what is here in Reading quite a grey afternoon. So thank you for introducing yourself as you've been joining. Like I said, it's great to be here today. For those of you who were on the first masterclass, you'll know who I am. But for those who weren't, I'll introduce myself. I'm Catherine Wilton, one of the Deputy Directors in the Personalised Care Group in NHS England and Improvement, and working with all of our national partners on this Leadership for Personalised Care programme that we've recently launched online. So I just want to introduce you to the rest of the team today before I hand over to my co-host, Maggie Woods. So Simon, if you could switch to the next slide, that would be great, so that people can see the faces of the other people who are in our team today. So Maggie and I will be hosting the session for you today, and we've got some fantastic keynote speakers that you're going to be hearing from later about their views and thoughts about how we lead in co-production. So that's Anna Severite, Mira Griffiths and Karen Saville. We've got some tech support for you, the Zoom hosts, Molly and Rosie. So if you've got any problems at all, just stick any tech issues in the chat and they will do their best to help you out. We've heard from Simon, Slide Master and DJ, and we've got lots of people monitoring the chat and helping us to keep to time today to make sure that we can make it as interactive as possible, given that there are 240 or so people on the call and more possibly will join, but we're going to make it as interactive as possible for you so that you get hopefully a great session this afternoon. Today marks the International Day of Disabled People, which is fantastic. So it is actually great to be doing this session on leading in co-production on such a day. I think that's a very lovely coincidence. So just wanted to mention that. I'm going to hand over to Maggie to tell you a little bit about how the day was run and to introduce us all into the session. Thank you, Maggie.
Thanks, Catherine, and welcome everybody again. It's just lovely to see so many of you here and some old friends as well, which is great. So as Catherine says, I'm just going to do a few things around sort of how we're hosting the day. So those of you that haven't, it would be great if you could introduce yourselves in the chat box. And if you attended last time, and I'm really hoping that some of you did, could you tell us one thing that you learned from attending last time? And also one thing you'd like to learn, really, one thing more you'd like to learn over the course of the whole programme, not just today. So we would really appreciate you doing that in the chat box. And I can see some people doing that already, which is wonderful. So thank you. We've got some people who are monitoring our chat box today. So just to say that we've got Julie, Lindsay, Paul and Graham monitoring the chat box. So if you hear them speaking, they'll be helping Catherine and I with some of the comments because they're whizzing up so quickly. It's quite difficult for us to keep up with them. So you'll hear from our colleagues there. So fantastic. So let's see what we've got. So any feedback from the chat monitors on what people would learnt last time or one thing that they want to learn more of?
We've had a comment on from the last session in reference to John and Philippa's talk, and it was to remember to always ask the elephants.
Fantastic. And I think those people that didn't attend that last time, do watch the recording because you'll think we're a bit strange when we're talking about speaking to elephants, and you might think we've gone a bit strange. So thank you. Anything else?
Yeah, there are people saying that they've learned that leading with passion can get results, and how pleased they were to be linked with other people who share the same passion and sort of the power of people coming together like this, which is lovely.
Yeah, it is lovely. And
the power of people telling me their own story.
Yes, thank you. And it's the power of creating a community and listening to people's stories is one thing that I think Catherine's been expert really at when she pulled this programme together, because you can learn a lot from theories and research, but stories are so powerful, and the passion people bring to those stories is wonderful. So thank you. I'm going to ask you now to do a poll, and Molly is going to do her magic behind the scenes and pop a poll up on your screen really. And what we'd like you to do is to just have a think about what is your confidence in leading co-production right now, right at this moment in time? So please do vote now. Feels a bit like the X Factor when I say that. Lovely. And I love the way that we can see it sort of totting up all the time.
About 200 have voted so far, so keep going.
Nearly there. So maybe some of you might not be able to, the technology might not be quite working for you, but for those of you that can see the poll, we asked the question about how confident are you in leading co-production right now, because this is a leadership programme. And it's fair to say that, as probably expected, we've got most people sitting in the, from where 1 is low and 10 is high, most people are saying they're number 6, which isn't bad, but probably feeling like they've got more to learn, which is fantastic. And that's probably why you're with us today. So really brilliant that you did that. And thank you for taking part in that poll. It really helps us to know where you are and to hear where how you're feeling. So thank you for that. I'm going to just connect us back, and you may remember on the first session, and those of you who are unable to attend the first session, it's really important that when we're learning like this, we consider how we're working together. And first thing, remember that we have said before, but we are recording this session, but we're not recording the breakout groups. So please do pay that attention, and maybe think about how you might be showing up as a leader in this space right now. And what we want to do is create a safe space for discussion and debate, and but also perhaps be a little forgiving for any tech issues. I mean, we've got Molly and Rosie who are amazing and, you know, seamless, but do forgive us if there is any slight technical glitches, really. And then one of the things that people know I always talk about, but I talk about that when we're attending a session like this, you almost get out what you put in, and it's noticeable really for those people that throw themselves into this learning session. And it's about your mindset. If you've got a learning and inquiry mindset, hopefully you'll get a lot out of this session, really. And it's about understanding yourself, and that's the bit we put about in our superpower. Knowing yourself is your leadership superpower, and this is a leadership program. And someone talked about passion earlier, and let's think about how we can use our passion and our commitment to take this to lead in this space that we're working with. Don't forget, please do, those of you that tweet, please carry on and tweet. And what I'd really like you to do now is, if you're happy with these ground rules, please put I consent in the chat box. Our colleague Christy suggested that, and I think it's a great way of making sure everybody's happy with this, and just noticing again just the importance of confidentiality if you are in your breakout rooms as well. So thank you for that, and thank you for those of you who are whizzing up with the I consent, really. And then I'm just going to talk about the breakout rooms now, really. And what we've noticed is we got some really brilliant feedback on the breakout rooms. And as with everything, we're going to invite you to go into breakout rooms, to have really great discussions, to be curious, but perhaps not to be too polite, because you may not have one of the tutors in the breakout rooms with you. So get stuck in, introduce yourself and fully engage, and just crack on, really, and be curious about each other and get to know people, because we want to create this community, a social movement through this work. So we're really hoping that. And please notice those of you that contribute lots, but also notice if people are choosing not to contribute, but also bring people in that may be a bit quieter. So please encourage that in the breakout rooms. Catherine, it's back over to you.
Thank you, Maggie. So just very briefly then, I'm going to talk to you a little bit a moment about the leadership qualities that we're kind of really referring to, that we really mean when we're talking about leading in co-production, and give you a little bit of an overarching idea of what we think co-production is and how that might kind of help to shape what you discuss later, followed by the keynote speakers that I mentioned earlier, which will be great, and then putting you into breakout rooms, coming back together to share what we've been discussing and find out what's next on the programme. So on that subject, as you'll know, this is the second masterclass of Module 1, and the programme at the moment is 4 modules, which will all be quite similar. We've got a course booklet on its way very soon to you for this module, and there'll be some online materials that we'll be able to signpost you to as well. And each module will have a couple of masterclasses about the same length as this, in case you're wondering how long it will take to complete the whole thing. We will be in touch with you shortly about signing up for action learning sets, so watch out on your emails for this. Okay, so a little bit about leadership qualities then. So what are we actually talking about when we're talking about leadership for personalised care? So you'll see on the next slide that we have got a core framework of leadership qualities and behaviours which are about leadership for personalised care. And in that, co-production is threaded throughout. It's a golden thread, in fact, throughout this framework. The framework itself is based on some of the systems leadership behaviours developed by the Leadership Academy, but it goes one step further in saying what are the additional skills, qualities, behaviours and mindsets that leaders need if you want to lead a shift towards personalised care, and in particular leading in co-production. So I've just picked out some of the behaviours here from this framework, which we will be able to signpost you to. That relate to co-production. So, for example, if we look at the top left hand of this slide, leading in co-production requires us to have a deep knowledge of the local community. So it's about knowing who lives in the community, the organisations that are in the community, but also the community groups and other voluntary sector organisations that are all part of the community. And sometimes when we talk about working in systems, particularly at the moment when we're kind of in a crisis mode across health and social care, we do sometimes tend to think of systems being just about organisations, but they're absolutely not. Systems are about everybody who lives in the community, and leading in co-production needs people to understand that and also have a knowledge of the local community so that you can actually lead effectively, knowing what really matters to local people and the people who live in the area that you serve. Related to that is the descriptor in the top right hand corner there, which is about a shift really in mindset from seeing people as patients or service users, or even sometimes, you know, bed blockers or burdens on our services. Actually completely a different mindset shift to be thinking about people as assets, people who bring their own valuable experience and knowledge to the table, people who are part of co-creating health and well-being, and not just those who are using services. So it's a very different relationship with an individual and with a community if we're not there to fix and we're not there to do to, we're there to do with people. And you can see it says here on the bottom left slide, it's about how we practice. So it's about making sure that we're inclusive in our practice, but it's also about creating conditions for others to take the lead and take ownership of personalised care, co-production and community building. So hopefully that can form part of your discussions later. So this is just kind of building on what I said really. COVID aside, one of our biggest health challenges and areas of spend in the NHS is around long-term conditions. So around 15 million people are said to have a long-term condition, and about 70% of our NHS budget is spent on long-term conditions. So what we need really to get better outcomes for people and to use all of that resource most efficiently to get more for what we're investing, in fact, is new ideas and new ways of working, personalised care being one of those. So it's about, it's a completely different paradigm actually for public sector leaders, and it requires this mindset shift that I was speaking about before. And interestingly, it's that idea of seeing people as the same as us, human beings like us, instead of as other, is actually really, really important part of that. So there's definitely something around power and sharing power in the concept of co-production. The next slide is a definition of co-production, which is about 10 years old now, but I find really helpful because it's talking about co-production being about delivering public services, so wherever you're from, and in fact this could be voluntary services as well, so voluntary sector this also applies to, but delivering those things or doing those things in an equal and reciprocal way between professionals, people using services, their families and neighbours. So I put this up because I really wanted to stress that co-production isn't about working with other teams or other organisations. That term is sometimes misused in that way, but that's partnership working and collaboration, and that's really important. But co-production only ever involves working with people who use services. So I just wanted to stress that. And this ladder of co-production, which is kind of adapted from Arnstein's ladder of participation, shows the difference between doing things to people, which includes educating, so telling people that they should change their lifestyle behaviours is not co-production at all. That's right down the bottom of the ladder. And where we actually want to get to is co-designing, co-production, that equal and reciprocal relationship. And of course, some of us, many of us, are somewhere in the middle. Consultation is something that we do kind of because it's a statutory requirement sometimes, and we try to engage people, but sometimes we're engaging people in something we've already thought about, whereas co-production is when you start with a blank page. So if we go on to the next slide then, Simon, if that's okay. You'll remember this slide from last time, and it's why do we need co-production? So it's the one before, the one which we call the in town planning circles, the desire line. And the reason we need co-production is because if we spend all of our money just getting experts designing something, then actually it's going to waste a whole load of time and money, because we're not working with the people who actually are going to use that path to decide where they want to go and how they want to get there. And actually it would have taken less money and less paving to just take that diagonal line across there in the first place. So I just put that up, one up again because it's really relevant. On co-production then, just before I bring in the speakers, it's sometimes helpful to think of co-production on 3 levels. So I've taken these definitions sort of roughly from Nesta's People Powered Health programme. And co-production on an individual level is about that individual person providing care. So I noticed there was something in the chat came up earlier about, I want to know how this works on a ward. So if you're an individual providing care, or you're somebody in charge of a team of people who are providing care, how do we make sure that we have that equal and reciprocal arrangement between a relationship between the person who's on the receiving end of the care and that person who's providing it? So do we start with the important question, what matters to you? What's important to you? What do you want to get out of this conversation? Or do we go straight in there because we're really busy and just tell people, and then we need to tick a box and go? Whilst that is completely understandable, if we really want things to shift, for people themselves to be able to take responsibility and take control of their own health, we've got to do slightly less of the telling and more of the listening ourselves. So there's a point of us as leaders, how we encourage much more of that equal, reciprocal, one-to-one relationship to happen. There are 2 other levels though. The middle one is that community co-production that I was talking about earlier. So that knowledge of the local community and everybody who is part of that community and has a stake in that community and the health and well-being of that community. And Nesta coined the phrase more than medicine. When we're thinking about what we do in terms of commissioning services, delivering services, we're quite often only talking about statutory services, but actually we need to be doing far, far more to grow grassroots supports for people, which are absolutely vital for health and well-being. So whether that's peer support, which is part of the personalised care model, whether it's things like time banks or other community development methods, and ways that we can support local groups to emerge and to be sustainable. And in some, we could call that or refer to that as mutual aid. And so many mutual aid groups grew up around the beginning of the COVID crisis, and has just shown the power of communities to step in, for people to get to step in and help their neighbours and friends when the crux is. Somebody's asked in the chat what's a time bank, and I will tell you a little bit more about that either at the end, or we'll send some information on for you about time banking. The last level of co-production, some of you perhaps more familiar with this, would be strategic co-production. It's when we're involving people, local citizens, in a ongoing, meaningful way about what's important to them. So that's about co-designing services, co-commissioning, co-delivery, in fact, as well, but doing that in a meaningful and not tokenistic way, which is the key. Okay. So I'm just going to flick over the next few slides. I've got some interesting inputs in here, but partly this is so we could send you the information afterwards. This one, just touching on it, was about the fact that people are living every hour of their life with a long-term condition, and actually not that long is spent with a health professional. So the importance of focusing on the 8,750 hours that the person's on their own self-managing, rather than just the 10 that they're with a health professional. So the more we can do to support people to self-manage, the better. And this slide shows you that you know, some various bits of research which have shown that is a cost-effective way of providing service. It involves us doing something different, though. That's the thing. If we carry on doing what we're doing already and we don't do enough co-production, we're not going to reap the benefits. It's not actually ending up with more work for us. In the end, as you'll hear from a little case study I'll finish with, it can mean less, but it does involve doing something different now, stepping into the unknown in some cases, to enable something different to happen and to reap the benefits of it. And these are all the skills that could be in your community that could help you improve health and well-being if you're a leader who's working at a strategic level, if only you go out and ask people on an ongoing and meaningful way, and not just consultation, saying, what could you do to improve the health of the community around here? And in old-fashioned terms, that was called community development, but it's absolutely vital. What can we do working with all of our statutory sectors and voluntary sectors as partners in a place, and the citizens who live there, to find out what we can do together. So somebody's put in the chat, woohoo, asset mapping. And of course, that means really doing, it's important that we do that with citizens, that we don't just as professionals go out and map the assets like we should know any better. In fact, we're only going to know where the assets are by asking people, and sometimes people are more likely to tell you what they can contribute if they are being asked by somebody who's like them. So the more people we can get involved in asking the questions and co-producing and co-commissioning with us, the more likely we're going to get participation out in the wider community. And the next, this slide here, yes, just shows that, you know, this isn't just something woolly or nice to have. It's actually life or death. People with good social, strong social relationships are likely to live longer than people who don't. So the more we do to increase the amount of connectedness in local communities, just like Ian's put in the chat there, it's about social network analysis. So social networks, not just being Facebook, but who we're connected to, who our friends and family are, and those areas where people might be disconnected. That's a very, very vital part of the piece here. Okay, so I'm just going to, there's a few other bits here, but I'm just going to move on to the slide which has got the case study on, which is about Altogether Better, to show you kind of like what can be achieved actually if you think about this in leadership terms at a small enough level to be doable. So Altogether Better is one of our partners on this programme, and they do a method of community development that's based around GP practices. So they work with a GP practice and they go and they ask people what could they do to improve the health and well-being in that practice. And there are some amazing stories, like, for example, a text message going out from the surgery asking people what they could give to support health and well-being or grow health and well-being in the area, being met with hundreds of responses of what people themselves could actually do, hundreds. So this is not about GPs doing more or practices having to do more, because everyone's incredibly hard pressed. It's about doing more with the assets in the local community. And actually what they found is it's not just about groups being set up. It's not just about the knit and natter club that might start, or the cooking group, or the coffee morning that happens as a result of asking people to gift their time, which is a bit of like what time banking is, actually people to give up their time to the practice to help others. But it changes the culture. so that over time the GPs and those people working in the practice begin to see those people who are involved as part of the co-creation of health in that local community, in that local practice community, as colleagues and partners. And Alison McGregor, who works with us on this programme, says that the kind of like where she sees the point of success is where the volunteers start to get allowed to be allowed to use the staff room to make a cup of tea. And that's where you move from somebody who is different to somebody who is a colleague and a co-creator, a co-producer in your practice. Now, I'm not suggesting you just open the doors and let everyone into your staff room. There are kind of stages to go through first, and all of this is about building trust and relationship between people. But in the end, this kind of approach does take pressure off clinical services. Fewer GP appointments are needed in the practices where Altogether Better has worked, where this has been done really well, because there are more things, people's needs are being met differently, basically. So I'm going to introduce our speakers now, and if there are any other questions that come up in the chat that are relating to some of the other slides, we can kind of bring those into conversations earlier. But I don't want you to miss out the opportunity to hear from our wonderful speakers. So I'm going to introduce them to you. So first of all, we've got Anna Severite, and delighted that Anna's here. So she's one of the tutors on our programme. As you may know, we run a national programme and regional programmes as well as this online one. Anna is one of the conveners of Social Care Future, which is a relatively new social movement that's grown up, a movement of people who want social care to be about living a life and not just washing and dressing. Before that, Anna was co-chair of the Coalition for Personalised Care and qualified as a medical doctor, and she herself is disabled and relies on health and social care. So Anna, thank you and welcome today. Dr. Miro Griffiths, MBE, is a research fellow in disability studies at the University of Leeds. Miro's been involved with our programme right from the beginning, actually, in 2012 when we started this work. So we're delighted you're still with us, Miro, to share your fantastic expertise. Because as Miro is also an advisor to the UK government and the European Commission on disability policy, with a particular interest in co-production. So we feel really lucky that he still wants to advise and help us too. And Karen Saville, who has lived experience herself and as somebody who cares. And unfortunately, as Karen describes, this has meant that she has been excluded from decisions about her and her life. So you'll remember the phrase that John Evans used last time, nothing about us without us, which chimed with quite a lot of you. And Karen works with us to try and influence leaders and practice to make sure that hopefully others aren't excluded from decisions that affect them now and in the future. So over to you guys. You're going to have a panel conversation and we'll come back to you in about a quarter of an hour. Thank you very much.
Brilliant. Thank you, Catherine, and thank you for that explaining of what co-production is. I think often that term is one that's bandied about. Three of us have had various experiences of it, and we're going to tell you some of those experiences and some of the things that we think make co-production work really well, or perhaps sometimes get in the way. So I'm really delighted to be joined by Miro and Karen. And I wonder if, Karen, you can maybe elaborate on some of those examples that you were talking about in your introduction then.
I will certainly try. Good morning, everybody, and thank you for asking me to be here today. I'd like to start by talking really about both personal and professional experience of being involved in co-production. The personal experience has demonstrated to me how difficult people find it is to work in a different way, because it does take a shift in thinking, practice, attitude and culture to actually do things differently, because it's about not only sharing the power, as Catherine said, it's about sharing the risk, letting go of resources, putting them back in communities where maybe they should have been in the first place. And that's quite hard to do when you're answering to complex systems on a daily basis. What I learned as I was trotting along life's ever-changing journey is that I was invited to lots of meetings. Now, some of these meetings I was invited to as a professional registered social worker. Now, once I entered the room as social worker Karen, I was automatically given a powerful seat at the table. I had a label that was respected. People assumed I had lots and lots of knowledge. I had some learned knowledge, but I didn't know everything about anything. I knew a little bit about lots of things. If I was invited to the same meeting as somebody who lives with long-term conditions, who is also a carer for somebody with long-term conditions, I was treated quite differently. Very often the outcomes had been decided when I got to the meeting. They knew what they wanted to do, and it was done with good intent. It was always done with good intent, but the road to hell is paved with good intentions, and the outcomes were already decided. So what do we do about that? How do we change that where people are actually involved in a way that's meaningful to them? You need to get down there and dirty in communities. I am an amazing community connector. I have knowledge. I know the nosy neighbour who knows everything what's going on. She knows what's missing. She knows where the money needs to be. I do also have some health and care knowledge as well, because I do still operate as a social worker. But it's the gaps and the resources that we need to work with to find out what's there, because these are people who know it. These are people who are living it. These are the pieces of the jigsaw that are missing. I work with a small charity, and we can make £1 do the work of £20. We have evidence to prove that, because we know how to do it. We do what people need and want, because we have better conversations, we listen, and we recognise that within communities, people are the answer. They're not the passive recipients of a gift model that they have been for years. People know the issues, people want to solve their own problems, and people want to have lives worth living, just like you and I.
Absolutely.
Okay, Anna.
Yeah, no, absolutely. I'm so with you on that, wanting to have lives that are worth living, and how it always often feels like a real battle. I think for me the other week, the power thing was really starkly shown. I was organising a meeting about my care, and I needed to email everyone the Zoom link, because of course, and the only people, there were about 12 people invited to this meeting, and the only 2 people that were uneasy and wouldn't give me their email addresses were 2 NHS employees. And I understand that, because obviously I used to work in the NHS, and they were like, oh, I don't know if we can give it to a patient. And I just thought, what is this? And so the way I had to get around this was that they would email a colleague of mine in NHS England that I had worked with, who of course herself is a patient of another doctor somewhere else and has been in hospital, you know, and is just like you or me, a human being. Yeah. And they would email her because she had an NHS England email address, but me as the patient couldn't be trusted with that. And it just really starkly showed me that sense of it's them and us. And we've got to get past that sense, haven't we, if we're going to work together in co-production and actually start seeing everyone as human beings rather than as professionals and patients, because ultimately we are all at times in our lives patients and people. And Miro, I know you've got loads of really great knowledge and background knowledge on all of this, so I'm sure you've got lots to add.
Well, I just reflecting on what you and Karen were saying, I think, yeah, there is an important point here about power. And often I'm trying to think how to put this politely. I think we're a little bit confused when we think about power, because we think about it in a case of possession. So somebody has power and you don't have it, so therefore there's no hope or there's frustration there. But actually power exists in the relations between people. And when you have people coming together who say, this is not ideal and we want change, wherever you are in the system, whether you have an opportunity to link up with other people who equally want change. And that power of the collective then, of bringing people together, challenging, offering an alternative vision, whether that's for an individual or for an entire community, or for rethinking our approach to service provision. You know, there's a real power in the collective. And I think, you know, that's something that we lose track of sometimes. It's particularly when we think about resources and mapping up, you know, what we have and who's where in the hierarchical system. And I think that's one of the things we need to move away from and recognize the importance of working together. And the other thing I would say as well is it's also power in the existing policies and legislation that can help us try to move conversations forward when people are being a little bit stubborn or people aren't seeing the recognition and the importance of co-production. And when I was listening to Catherine, it reminded me, last week I was at a London School of Economics talk on the Chronically Sick and Disabled Persons Act in the 70s, which was brought in. And even in the 70s, even in that piece of legislation, there was clear recommendations of disabled people should be involved in every conversation that matters and affects them as an individual or them as a community. And now when we have, International Day of Disabled People, we have the United Nations Convention on the Rights of Persons with Disabilities or Disabled People, there is still a recognition of we must be bringing disabled people into the conversation and people who require support to improve their own lives, but also improve their community. So it's about trying to think about our values, but also think about the basis, the legislation or the power of policy, it also to try and move the conversation forward.
Yeah, absolutely. And I was thinking about a lot of the people on this webinar today or on this program. Some people I hear quite often say to me, oh, well, I'm not a leader, because they're used to that very hierarchical structure within health and social care that says that person's a manager, that person's a chief executive, that person's a band, whatever. And there seems to be this sense, and what I think, I was reflecting back and I was thinking, no, we've all got to take responsibility for this stuff, and we've all got to be in a place where we're saying this is the right way to do it. We're going to maybe challenge where we see it's not being done, but also champion it and try and spread this around so that it becomes the norm within the systems. And I was thinking of some of the values that I think, or the behaviours, I guess, that leaders would need to exhibit to bring co-production into more into health and social care. And for me, it was things like openness and not always trying to have the solution to everything, but actually admitting that actually I hold some knowledge, but so do other people, and being prepared to share that. And then also giving your teams and your colleagues and anyone that you do manage permission to try things differently and to take some of that responsibility off them and say, actually, no, I'm going to support you in this, because I feel too often people are scared to try this. Are there anything else, Karen, that you think, you could advise leaders to try, and anyone? When I say leaders, I think it's anybody in health and social care.
I think to work differently requires leaders or people who are making the change to be bold. We have to be bold. And if we're going to work with people in communities like we say we are and we should, we need to recognise that some of those people don't have the systems that we normally transfer resources to, that we transfer funding to. They don't have 3 years of accounts, but that doesn't mean they can't do it. What that means is we have to think about how they can do it and how we can support people to do it differently. Because as long as we prescribe it in health and social care, we're happy with that. But as to let go and just give it so people can grow their own, which is what this is about, is very difficult for us to do, because we haven't got the backup of the system that we're used to, and we're taking a risk, and nobody likes to take risk. But to remove risk is to remove opportunity for growing and living. So we've got to be bold and move forward.
Absolutely.
Well, just building on that, I think that importance of creativity is key. And we've lost that, I think, even outside. We're talking today about health and social care, but even outside of that, we've lost opportunities and environments to have creativity. And that's not a criticism of the individuals. It's probably a reflection of the system that tries to push people in a particular way of just doing the same thing over and over again, and not having the feeling or not having the resources to challenge and to try to bring about individuals and groups who will be able to instigate that creativity for an alternative which is more possible and preferable. And I think one way to do that is to utilize the disabled people's organizations in your local area. It's no surprise that good examples of co-production tend to be where you've got a strong activist network of disabled people who run their own organizations, who are engaged in articulating a vision for sufficient support so people can do the things they want to do with their life, but they're also embedded then within the decision-making framework and the commissioning framework to bring about alternative creativity. And as John said last time, nothing about his resources. It is key to this, absolutely. But it's also, I think, how to look at those barriers within society and those unnecessary barriers within society. I don't just mean in terms of the built environment. I'm also talking about those barriers that are put in place through existing policy and how to try to change that. We must be starting from the position of the individual is not the problem, and it's not the individual's responsibility to change to fit into the system. It's about identifying those unnecessary barriers and then thinking of creative ways to remove them.
Yeah, absolutely. We've got about 2 minutes left, so I'm going to kind of give you both a chance to give your kind of one key message that you'd want people to take away. I think for me, one thing, Catherine mentioned it briefly about starting with a blank sheet, and it's really unusual for me in all the co-production that I've been involved in, that you come into a project, usually a problem has been identified, and then they start looking for people to come in to help them solve it. And I think that's one step too late. You need to be actually speaking to people in the community, people that use services, to identify the problem and to work at that stage with what the project is that needs to happen, because it's probably a different project to the one that you thought you needed to run. Karen, I see you nodding.
Yeah, for me, it's remember people are the solution, not the problem. And we need to remember that all people, all human beings have 2 eyes, 2 ears and 1 mouth. And there's a reason for that, because we need to look and listen twice as much as we speak. So get down there, get dirty with the real people and understand where they're coming from and just do it.
Yeah. And Miro?
Well, I think just to add to the excellent points that you both made, I suppose something else to think about is the importance of intersectionality. And what I mean by that is recognizing the unique experience that emerge when we think about how different aspects of our identity or our background intersect and cross-sect. And the reason for that is because so often when we think about policy change or policy initiatives, or indeed co-productive strategies, we can tend to default to, right, we need somebody who speaks for this community, we need somebody who speaks for that community, and where's our representation there? And actually it's about building on an intersectional playing field of recognizing, well, people are coming with unique experiences, and we want to see, and we want to embrace those unique experiences, so we can think about how our ideas for creative solutions are not just going to be affecting one single strand of a community. It's going to be having an effect, and hopefully a positive effect, on the ways in which we identify. Because as a disabled person, I don't just identify as a disabled person. I also identify as somebody who's from Liverpool. I also identify, in terms of my sexuality. So it's about recognizing how policy intersects with that, or has failed to intersect with that. I think co-production is a useful way of trying to unearth some of those important points.
Brilliant, thank you. I'm going to hand back to Catherine.
Well, thank you so much, the three of you. I really enjoyed earwigging on your conversation, and it's not exactly handing back over to me, just to kind of see if anybody's got any questions. So we've got about sort of 8 minutes to kind of get some feedback. The chat was going wild when you were talking, by the way, and people particularly loved your point about the speaking less than we look and hear, Karen. So I'm just going to ask the chat monitors if there are any kind of particular themes coming through, or things that either challenge with people or questions that people have for any or all members of our panel. So could I come first to Julie? Anything that's come through from your point of view, Julie?
Yeah, there's been some really interesting comments. So one person was saying that thousands of patients have had their email address, and they wouldn't have been anywhere near as effective as they have been without that. Somebody else was saying on Miro's point, he's right, we've got to be careful not to present it as giving power, as then it gives the impression that we've got all the power to be given. And what we should be doing is suggesting that people take power and take control. People love the quote, Karen, about looking and listening before we speak. And then somebody, I thought that was interesting, somebody said it'd be interesting to take a poll on how many people in decision-making positions live in the community that is affected by that decision, and how much decision makers are thinking this is about us as a community rather than this is about me and them. So I thought that was an interesting discussion in the chat as well.
Interesting. So do take the opportunity to put any questions in the chat now, as well as comments. If you've got anything specific that you'd like to ask, do put those questions in there now. I'm going to come to Lindsay. Is there anything else that you've sort of picked out that that hasn't been mentioned by Julie, or any questions that are coming through at the moment?
Yeah, I think it was Maggie who got a lot of positive response to a comment. It said leadership is a verb, not a title. So that there was a big reaction to that. And also we've got a question here is, how do you deal with people who say that they do co-production and they're involved with it, but then they don't? It's how would you get those people on board to really nail it down and do it?
The misquoting George Bernard Shaw, isn't it? The greatest problem with co-production is the illusion that it has happened. Have you got a comment on that? Anyone from the panel?
Wow. I mean, I've at various times I've used different methods. I don't know which is the most successful. There've been times when I've called it out and said, this isn't co-production, I'm not going to be involved in this, or kind of being quite firm in that. There's been other times where I've thought, I'm going to get involved with this, I'm going to be clear that we need to improve this, but I'm going to try and influence it and try and I think it's difficult, because if in one way you can then feed that person's sense of, oh yes, I co-produce really nicely, but in another sense they'll never learn if you don't demonstrate how to do it better. So I don't know, the other two might have better ideas.
Cyril?
Yeah, I can go now. Well, I mean, for me, I think it's about creating the dialogue. So usually when someone's talking to me about their co-productive examples and I'm not entirely convinced by their examples, I'll tend to ask them first, what do you mean by co-production? And then use that as a gateway then to start saying, well, this is how I see co-production. Is that reflected in what you do? And if it's not, why not? And you know, in terms of what you think co-production means, what about these aspects that other people may raise as important? And I also think it's about questioning those people in terms of, well, where's the reflective space that you create for those, excuse me, for those who are involved in the, you know, the project, the program, the drive for change? Where is the opportunity for everybody in that process or that system to have an opportunity to reflect on what they're doing and why they're doing it and whether that's working? And I tend to find that those who aren't doing what they think is co-production tend to not have much space for reflection or much space for that creativity. They become very process driven, very service driven in trying to say, right, here's a problem, let's get people together, let's do it. We're doing it co-productively, but not really. And then they finished it, let's box it up, let's move on to the next problem. And it's trying to find those windows of opportunity to question, I think, and start the dialogue.
And I very much agree with Miro. I'm probably a bit more rebellious in that I will ask what they're trying to achieve. What are you co-producing? What are we doing? And if they say, well, we're going to have this at the end, well, actually, no, that's not co-production. So let's start again. Let's put that away to one side. And let's start again, and then go back to where Miro is and say, well, what is co-production? What are we doing? And then go through the stages. Because I think sometimes people with good intent think that they are doing it. However, they don't understand what you have to do. They don't understand it takes time. As Miro said about reflection, you've got to, and if you're doing it well, then everybody's got to have the opportunity to contribute. And some people, it takes time, a lot more time than others. So you can't do something in co-production in half an hour. It's usually done over a series of stages, and it's a growth. And unless you can see that growth, then it's not co-production.
What I would say is you're absolutely right, but it can also be quite simple. So one of our tutors on this programme, Clinton, like me, shares a real dislike of the term hard to reach groups. Because groups aren't hard to reach. People living in their homes, aren't they? They're just going about the day-to-day business. It's just that we're not going to find them. And the definition of somebody who perhaps is a leader in co-production, very simply, could be somebody who's known down the precinct, how often are you walking the community? How often are you walking the floor of your organisation and talking to people who use services? Because you'll know if co-production's happening well if you say, what matters to you, and do you feel that everyone's focused on that? And if the answer is no, we know that there is definitely a step to better to take. But we don't have to solve it all at once, because you're right, Karen, it takes a long time to really change culture. Maybe time for one more question. Graham, is there anything that's come through from your point of view?
Yeah, so quite often people are asking about how you break out of the constraints of your organisation, as a bit about governance. So any views around sort of breaking out of the rules and regulations and constraints of the established organisations you might be working with?
Well, if you can solve that, we can all go home after this. So it's true, isn't it? The importance of recognising the barriers that people working within systems face, that they might want to do more co-production, but what could be a step that leaders could take to try and remove some of those barriers themselves, their teams, or the system itself?
Shall I go first?
Yeah.
Yeah. So I think there's something here about how to identify your allies first and foremost. And that may be within your team, but it also may be across your community as well. Because and again, this goes back to my point about power. Before you think about power, there's resistance. Resistance has to exist for power to exist. So actually being in a position to say, well, this is not the way we want to do it, or this doesn't make sense, or doesn't work for our communities, you have to then establish those resistance practices. And you do that by bringing your allies together to talk about, well, why don't we feel comfortable with what's happening now? And then it's about making sure that you're collecting people's experiences, you're creating that evidence-based to have the rationality to say, this is not working, irrespective of where it came from and why we're doing it. Let's focus on actually reimagining this and reorientating towards a much more inclusive and accessible and participatory approach to supporting people in the community. So I think it's about evidence and it's about allyship.
I think if an organisation was truly doing this and living this way, it would be built in a very different structure, because you wouldn't have that sort of hierarchical structure in a sense. But we have to be realistic that we are often working within those structures at the moment. And I suppose for me, there is something about saying, actually, I have had to fight for a lot of basic right of care that I needed to be able to live my life the way I want to live. And I know a lot of people have had to do that, disabled people, people with different conditions. And there's something about actually now we need people within the system at whatever level you are to become an ally to us, to become an advocate for this stuff, and to become a real champion for it. And sometimes that may mean feeling a bit uncomfortable, and it may mean having to sometimes be the sort of slightly lone voice in your team while you try and convince other people and bring them along with you. It's not about becoming an angry voice and alienating people. It's about actually trying to influence and make this so that eventually, I would really love to see that in 10 years time, 20 years time, actually our big public system structures do look quite different, that they are much more inclusive, that they are much more about a sort of co-productive, collaborative approach, and not about this kind of hierarchy. But yeah, it is about everyone stepping up and taking a bit of that responsibility for me.
One final brief word from you, Karen.
I think for me, we have to question, are the barriers real or are they perceived? Are they what we see as barriers, or are they around risk and sharing the power? And sometimes the barriers are smaller than we think. We've just not done it that way before.
Brilliant, thank you so much, and hopefully you can stay on and you can hear the discussions that will be going on in small groups and get a chance to see what an impact we've made, hopefully, by our session this morning. So just going to hand over to Maggie. Thank you.
Thank you, and just thank Miro, Anna and Karen. It was just wonderful, and I just noticed really the last point about, are the barriers real? And I'm just reflecting on what we've actually achieved in the last month during the pandemic, where we just got on and did things, and we just managed to do amazing things, and the barriers disappeared. But so just a reflection on that. What I'm going to do now is invite you to join a breakout room, and before I do that, I just check back in on our ground rules really around the confidentiality And just getting stuck in, please, guys. That's important. We've got a short amount of time, and we want you to go into these breakout rooms with sort of curiosity and engagement. We've got 3 questions which we've popped up on the slides there, and feel free to take a photograph of those if you can't remember them. And what we'd like you to do is to think about your best personal experience of being involved as an equal in something that affects you in either health, social care, in education, as a service user, or as a member of a community. So where has something worked really well? So an example of where co-productions worked well really is what we're looking for. And then what effect did that have on you and on the outcome? And maybe reflect on times that you weren't included and how that might have felt. And then, because this is a leadership program, we want you to think about what would one step to better be in building co-production in your leader? Because as I'm listening to Anna, Mira and Karen, I'm thinking, gosh, this is massive. But maybe let's just start, if we go back to elephants again, what is the one thing that we could do to chunk up our elephant, as it were? So just think about one thing. And just a reflection really on if you've had experiences that haven't gone so well, don't dive in with those, but just reflect on maybe that if something hasn't gone well and you haven't feel included, maybe reflect on that and maybe reflect on the learning and bring that into the breakout groups. So trying to sort of turn it round into more of a reflective space. So I'm hoping that the wonderful Molly and Rosie are in the background and will then automatically put you into the breakout groups. And as I say, do engage as quick as you can. Welcome back, everybody, as you're joining us from your breakout groups. I hope you found the conversations helpful and inspiring. I'm sure you did. What we'd like to do just in the last few minutes before we finish off today is really hear some feedback from what your discussions are and what came from you around the 3 questions we asked, which was about your best personal experience. So something where co-production went well, the impact it had on you really, and the leadership challenge you might take forward. So I'm going to invite Julie, then Lindsay, to just give us some feedback from the groups that they were in.
Just some of the things that are coming through chat is people are saying thank you for the facilitation. Wendy said everyone has a lived experience, and that just really massively resonates with me, and I'm sure it will with Karen as well, about having that role of, are you a professional or are you somebody who uses services? And more often people have both and do both. So there's some lovely links going on around the Leadership Foundation. People saying co-production happens all along the way of experience, and people have got to be able to offer them options and facilitate that.
Thank you, Julie. Lindsay, is there anything you'd like to build on or add?
Sorry, rookie error, mute. It's coming through the chat and also experiencing the group that I was in. It's like we just felt like we were warming up, like we could have chatted about this for such a long time. There's such richness to these conversations. A lot was like having a bad experience, but knowing and taking ownership of that, taking control and wanting to help others that might be going through that, trying to change the narrative, the path. Some of the ways that we could better co-production is just making sure that we've taken the time to listen, communication, coming in with an open mind and making sure that we don't make assumptions. But it's really important to get that open communication.
Thank you, Lindsay. And yeah, we were acknowledging earlier about the fact that these sessions probably aren't long enough and we would love to be longer, but as a starter and starting to bring us together and having the conversations, they're hopefully they're a really good place to start. And we do want to build that community and but you know, it goes back to the point I think Karen was making about listening and having an open mind. So that curiosity is really, really important in this space. So thank you both for that feedback, and I'm going to hand back to Catherine now.
Thanks very much indeed. So the really interesting stuff coming through the chat. I wonder, I think it would be quite helpful from us when we're thinking about achieving change or developing leaders. It's about that change in mindset, and clearly some people on the call were already on this page and feeling validated and feeling very included in our community today. Some people who might be learning about co-production for the first time, who are at an early stage, have been quite inspired by some of the stories. Could you perhaps put something in the chat of one thing that you've learned or are taking away from today? And what we'd be interested in is, does it change action? So is there anything different that you might do as a result of today? If you could just put that in the chat, that'd be quite useful to see if there's anything that's that might come out of it, that where we can actually see a tangible difference being made. So one thing you've learned or are taking away from today, in particular, something that you might do. Just going to give a couple of minutes to see if there's any ideas of things that you're going to do or that you've learned to come through from the chat. So I'm sure if you can see the chat, you'll see there's loads of really great things in here. So some of it's about mindset, about being open-minded and giving people time and respect, staying curious. So a lot of these are kind of ways of being, I suppose. People talking about co-production competency framework. So there are some tools that we can share with you. And thinking about one step to better, is there anything that you that came out from your discussions in terms of one step to better? Lindsay, anything coming through from the chat in terms of one step to better?
We've got, it's all about a can-do approach. It's having that positive mindset, and one step to better, adapting to needs. And to ask what matters.
So asking the questions that are important,
Yeah.
right? Brilliant. Okay, that's great.
Yeah.
And
some very specific ones
Julie.
as well. There's some very specific ones. So somebody's going to go and look at what Altogether Better do with GP surgeries. Somebody else is going to go and explore what time banking is. So there's some direct action that people are sort of taking away and wanting to put into practice.
That's great. Thank you. Thank you very much. So we're going to try that poll again now, if we've got it ready. So on a scale of 1 to 10, could you rate your confidence in leading in co-production right now? And let's see if there's any difference. There might not be. It might even be less. Sometimes you don't know what you don't know until you find it out. Let's see if there's a difference in your confidence levels in leading in co-production. Half of you have voted. We need some countdown music now, don't we? Somebody's asking, will the comments be available after the talk? It is our intention that we will take the chat from this and from the last session, do some analysis of it and send it to you, but just bear with us because we've been also delivering other leadership programs over the last week, so we haven't had much of a breather. We don't want to just send you all of the chat, but we'll try and analyse it and turn it into a Q&A or distill it in some way for you. So I think most people have voted, maybe 2/3. And what's really interesting is that people's confidence level has gone up here, I think. There's fewer people in the 1, 2, 3 and 4 categories than before, definitely. So it sounds like just talking about it and having an opportunity, even if it was only for 20 minutes, to share with like-minded people about what could be a one step to better in leading co-production does change things, even if this, even a small amount just change things significantly for you. So thank you so much for participating, because you just coming here has made a difference, and will make a difference, I'm sure, as you go on in your practice. So I just want to tell you what's coming up. Because as people were saying that they could have heard more, they could have had more slides, there's more they'd like to learn, more they'd like to know. First of all, I just want to tell you about the action learning sets. So we're going to be sending out applications for our action learning sets very soon. This will be a bit more formal than these masterclasses, so they're open to all and they are still free, but there's more of a commitment required. That if you join a group of about 6 of you, there will be a commitment to attend all 4 sessions of action learning sets, because the action learning set you actually support each other as you go through. We're intending to start those in January, so we're looking for people to apply through December and beginning of January. There won't be a space for everybody, so we will have to come up with some criteria, and one of those criteria will mean you can definitely make the dates of the set, so look out for that. We've got more live events and module 2 coming to you in January, so that's all about leading in complex systems. Some very exciting speakers lined up there. So we've got Professor Mary Albeen from a university in Texas, and we've got Mark McCurgo, author of Host Leadership. We've got the course booklet to follow and other online resources as well. And then last, to leave you with my final thoughts on leadership. I nicked this from someone else, obviously. So the thing that I think is important to remember is that there isn't necessarily a path for doing this. We would like blueprints and we would like guidance, and we want to know exactly how to do it. But there isn't actually a path. The path is made by walking it, and it's just going out, talking to people, asking the right questions and trying. And if we do take one small step, that can be translated into lots and lots of big steps, and can have an amazing effect on the people around us if we approach our leadership in this way. So I would encourage you to have a go, even if that means that the first step is not quite known, because that is the only way, I think, to lead in complexity. And I just wanted to say thank you very, very much, everyone attending. Have a lovely Christmas, and we shall see you hopefully in January or in our action learning set. So thank you for attending. Thank you for all our speakers, and see you very soon. Bye everybody.
Bye.
Thank you. Bye bye.
Hit the